Vitamin D is a vital nutrient that is produced by the body in response to sun exposure. Despite its role, many people lack the adequate amounts. This accounts to about 1 billion people worldwide. Vitamin D is also known by the name sunshine vitamin. This is because it is released to the body in response to exposure to sunlight and is rarely acquired from foods. Sunlight does not give you vitamin D but helps the body produce it. Vitamin D is a fat-soluble vitamin, hence fat is required in the diet in order for it to be absorbed into the body. One of the classic signs of vitamin D deficiency is bone and muscle pain. Inadequate levels of vitamin D can compromise calcium absorption, resulting in weakened bones and muscles. Individuals may experience chronic pain, particularly in the back, legs, or joints. In severe cases of vitamin D deficiency, children may develop bone deformities such as rickets. This condition is characterized by weakened and softened bones, leading to skeletal abnormalities. Vitamin D plays a crucial role in the immune system, and its deficiency may slow down the healing process. A weakened immune system is a consequence of vitamin D deficiency, making individuals more prone to frequent illnesses and infections. Adequate vitamin D levels are essential for the proper functioning of immune cells and the body's defense mechanisms. Individuals with low vitamin D levels may experience increased joint pain and inflammation. Vitamin D is essential for maintaining muscle strength, and its deficiency can contribute to feelings of fatigue and weakness. Individuals with low vitamin D levels may find themselves more easily fatigued, both physically and mentally. Some studies have found associations between low vitamin D levels and an increased risk of depression and mood swings. Vitamin D receptors are present in the brain, indicating its role in cognitive function. Some studies suggest a connection between low vitamin D levels and cognitive decline, as well as an increased risk of neurodegenerative diseases. Although the relationship is not fully understood, there is some evidence to suggest that vitamin D deficiency may contribute to hair loss. Proper vitamin D levels are essential for maintaining healthy hair follicles. There are several factors why someone might experience a deficiency. This include inadequate sun exposure. Sunlight is a primary source of vitamin D as the skin synthesizes it when exposed to ultraviolet B rays. Factors such as spending too much time indoors, using excessive sunscreen, living in regions with limited sunlight, or covering the skin for cultural or religious reasons can lead to insufficient sun exposure. Limited consumption of vitamin D-rich foods like fatty fish, such as salmon, mackerel, cod liver oil, fortified dairy products can contribute to vitamin D deficiency. Vegetarians and individuals with specific dietary restrictions may face challenges in obtaining enough vitamin D through food alone. People with darker skin have higher melanin levels, which can reduce the skin's ability to produce vitamin D. Increased melanin acts as a natural sunscreen, limiting the absorption of ultraviolet B rays and subsequently impacting vitamin D synthesis. Individuals with darker skin may require more extended sun exposure to meet their vitamin D needs. Certain medical conditions affecting the gastrointestinal tract, such as celiac disease, Crohn's disease, and inflammatory bowel diseases, can impair the absorption of fat-soluble vitamins, including vitamin D. Surgical procedures like gastric bypass can also lead to malabsorption. Aging affects the skin's ability to produce vitamin D efficiently. As individuals get older, the skin becomes less efficient at converting sunlight into vitamin D. Older adults may also spend more time indoors, further exacerbating the risk of deficiency. Vitamin D is fat-soluble, and individuals with obesity may sequester vitamin D in fat tissues, making it less available for the body to use. This can lead to lower circulating levels of bioavailable vitamin D, even if there is sufficient intake. The conversion of vitamin D into its active form occurs primarily in the liver and kidneys. Liver or kidney disorders can disrupt this conversion process, leading to decreased production of active vitamin D and potentially contributing to deficiency. Some medications, such as certain anticonvulsants, glucocorticoids, and weight loss medications, can interfere with vitamin D metabolism. Individuals on long-term medications should consult with their healthcare providers to monitor and address potential vitamin D deficiencies. Chronic diseases such as renal failure, multiple sclerosis, and certain autoimmune disorders may be associated with vitamin D deficiency. Managing these underlying health conditions is crucial to preventing or addressing vitamin D deficiency. People living in latitudes with limited sunlight, especially during the winter months, may have difficulty obtaining sufficient vitamin D from sunlight alone. In these regions, dietary sources and supplementation become more critical. The diagnosis of vitamin D deficiency can be done by checking the serum levels of calcium, phosphorus, vitamin D, as well as parathyroid hormone levels. An X-ray of one's bones can be done to check for rickets and osteomalacia. The treatment of vitamin D deficiency involves various strategies to restore optimal vitamin D levels in the body. Safe exposure to sunlight remains a fundamental aspect of treating vitamin D deficiency. Sunlight stimulates the skin to produce vitamin D naturally. Spending about 10 to 30 minutes in the sun, at least twice a week, is generally recommended. However, the duration varies based on factors such as skin type, time of day, and geographic location. Increasing the intake of vitamin D-rich foods is essential for addressing deficiency. Foods such as fatty fish, including salmon, mackerel and tuna, cod liver oil, fortified dairy products, egg yolks, and certain mushrooms are good dietary sources of vitamin D. Including these foods in the diet can help supplement vitamin D intake. In cases where sunlight exposure and dietary changes are insufficient, vitamin D supplements may be recommended. These supplements are available in various forms, including vitamin D2, also known as ergocalciferol, and vitamin D3, also known as cholecalciferol. Vitamin D3 is often preferred as it is more effective at raising and maintaining vitamin D levels in the body. If vitamin D deficiency is associated with underlying health conditions such as malabsorption disorders, liver or kidney diseases, or certain medications, addressing these conditions is an integral part of the treatment plan. Managing the underlying cause helps prevent recurrence of vitamin D deficiency. Encouraging lifestyle changes, such as spending more time outdoors and engaging in outdoor activities, can enhance sunlight exposure. Maintaining a healthy weight and addressing conditions like obesity can also positively impact vitamin D metabolism. If you found this information helpful, don't forget to give the video a thumbs up and consider subscribing for more content on health and wellness.